A little bit about my practice. I opened, I'm 51 years old, and in 2003, at the age of 36, I decided to hang my own shingle. It was probably right at the last moment where a doctor could do that comfortably before things started getting really difficult. I started with 0 patients. Being 36, I had a 3-year-old son. My husband's a physician. I got pregnant the next month. And my office manager was like, "What, the first year?" And I said, "I'm going to be 37. I've got to do this now." And actually it worked out really well because my practice grew slowly and my patients didn't even blink an eye. I was, like a true physician, I was back in 3 weeks. After a complicated C-section, I pulled myself into the office and started working again. And the practice grew, and it was great. And I knew I could do it because I could control certain aspects of my overhead. I knew there were certain aspects I couldn't control. But I wanted a boutique, small practice. I wanted to make a comfortable living. I didn't go into family practice to be rich, and I knew that. But I wanted to also be there for my kids. I built this practice. It allowed me to be mom. It allowed me to take really good care of my patients. They got my attention. It was almost like a DPC practice, but I was billing insurance. I was taking longer with the patients. I had longer appointments. And at that point, it was just really the E&M coding and HIPAA and OSHA and those kind of compliance things that I had to pay attention to. Then came all of the regulations with the insurances, and they were starting to look at our coding and our billing and our quality measures. And slowly, from 2003 to 2015, I saw things changing in my office. I was on paper charts. I had to go to electronic medical records. My overhead was going up. My reimbursements were flat. And my time with the patients was diminishing. And that's not why I opened this practice. I still have the 3 original adjectives. My goals when I opened in 2003, they're still on my bulletin board in my office. And I looked at them and I'm like, this isn't working anymore. And in addition, although I was part of the hospital physician organization, the PHO, which was soon to transition to the ACO, and they allowed independent physicians, although there were fewer and fewer of us, to participate. They would do group negotiations for reimbursements. I had found out by accident, somebody slipped, that they weren't negotiating the same reimbursement rates for non-employed physicians as they were for their employed physicians. But I had no recourse. It was just a small independent practice. But I did start participating in their insurance. The hospital has their own insurance product with their quality guidelines. And we did so well. I rated #1 for 4 years over all of the owned physician practices in the local hospital system for 4 years. And they used to come to me and they said, "How are you doing this? How can we get our practices to," and we get a bonus for that. And that's what kept my doors open, actually, when things got really tight. They said, "How are you doing this?" And I said, "Oh, it's really not hard. Your practices are too big. You got to keep it small, and then you have time to pay attention to these quality measures." Now, I hated every one of them because it was a waste of time, and it really wasn't increasing patient outcomes, but I did it to stay open. So when they were starting to change the Physician Health Organization, the PHO, to the ACO, I had been watching Josh's video. What was that, 2014 AAFP or AAPS? AAPS's 2014 video. My husband is in an orthopedic group. He's paying management. By the way, he's getting paid $75 for an epidural steroid in the lumbar spine. The doctor was just saying, yeah. And he rents 3 rooms and runs the whole time to try and keep up his revenue. So anyway, the president of his organization, which is still an independent orthopedic group in Allentown, they have been holding, I think they're fine now. They've made it through the rough part. But his president, who's an ex-Navy physician, Dr. Rich Batista, sent me Josh's video in 2014. And I remember it was like 1 o'clock in the morning. I was still staying up late then. And I'm watching this video, and I'm like, what? This just sounds too good to be true. And I just kind of filed it away. And then 3 months later, I looked at it again. I filed it away again. By the summer of 2015, I was ready. And I watched Josh's video again. I'm like, okay, I'm doing this. I literally, overnight, I went to my staff. I told them, I told my husband, "You guys are doing what?" I said, "I'm putting a bomb in the middle of my practice. I'm going to blow it up and then turn it into direct primary care." So they wanted to buy me. The hospital was circling like vultures. They loved my quality measures. They loved my staff. They loved the way I ran my office. But I knew if they bought me, they were going to split us all up. And I wouldn't be with my patients anymore. And I never wanted to be employed. So I said to my husband, look, if this doesn't work, I went down in a ball of fire, and I'll go work in urgent care in Philadelphia, where nobody knows me. So he was like, all right. And so I did it, and I called Josh. He was the first call I made. And it's just history since then. So that was the story. But the real interesting part is, so I was getting biannual bonuses for my quality measures from the hospital. There was a check that was due that August. I made the decision in August of 2015. There was a check that was due in August, and I haven't really talked about this publicly. This is the first time. And I knew I needed that check because of the transition. I was going to need it for advertising. I was going to need it to cover at least the first 3 to 6 months of my overhead because I didn't know what I was going to generate. I had already taken out another line of credit. And that check was supposed to come in August. So it didn't come. Then it was September, first week, second week, third week. Now I'm starting to sweat because I have to opt out by October 1st because I was going to open in January. I'm really starting to sweat. And I said, I can't send the letters out because the hospital, I knew they were going to either keep the check or decrease my bonus. Because I knew I wasn't being bonused the same as everybody else. I found that out as well. So I'm waiting. Talking to Luann Leeds. She has the letters ready to go. She's like, just keep your fingers crossed. Who's the lawyer that helps us opt out that Josh refers us to. So it's Friday, September 30th. I'm supposed to send the letters out on Saturday. They're literally lined up on my island in my kitchen. And I leave work Friday at 4, and my office manager was like, I can't believe the letters aren't here yet. Well, the mail hadn't come yet. And I said, look, I can't wait. I don't know what I'm going to do. These letters have to go out tomorrow. I said, do I send them out and hope the check's in the mail? And because I needed that money. It was like $20,000. So I went home, and she calls me at 4:30. She's like, you're not going to believe this. She's like, the check came. I'm like, I'm coming back. I'm getting it. I literally signed it. I deposited it right away at Friday, so I knew the check would clear, and the letters went out on Saturday. But I still walked back and forth by them on that Saturday looking at them. I'm really opting out of Medicare. I'm opting out of, oh my gosh, this is so scary. My son was probably 14 at the time. He goes, Mom, will you just mail them? So that's my story. And so I'm the first DPC in Allentown, and the only direct primary care, and that's because so many of my colleagues sold to the hospital and became employed. There's not very many independents left, but it's been quite a ride. There's been a lot of education in that area, and 3 years in, and I'm doing well. I'm in the black, which I'm very happy about. I'm very blessed. So being solo for all those years is scary to begin with, never mind doing DPC, which is a little scary too, until you get your feet on the ground. I had to make sure I was compliant as a solo practitioner. There weren't many independent solo practitioners left, never mind group solos, until they started selling away. So I had to maintain my own compliance. My best practices, not to make sure I did everything I could, not to avoid a lawsuit, my own HIPAA, my own OSHA, my CLIA. I had to do everything for 15 years. And so over that time, you're doing your risk management credits. I'm slowly compiling this great manual for my office, and my staff would follow, how to follow up on x-ray results, how to follow up on lab results, how to communicate with patients, how to document. And so I had this great manual put together. And when I can transition to DPC, I had to modify some of those because our workflow changed in the office, but same principles apply. And had to redo my OSHA and my HIPAA. We tweaked the HIPAA a little bit because things are a little different with DPC. And there's actually some questions whether we really even need to pay attention to HIPAA. I've talked to Twyla, I've talked to Andy Shafley, I've talked to Jeremy, I've talked to Phil and Josh. So there are some questions about that. But what I was seeing on social media, we have doctors who are transitioning into DPC that are coming right out of residency, that are coming out of employed positions, either a hospital-owned practice or a private practice where they were employed. Some are transitioning like I did and have run their own practices and were in charge of their own compliance. And, being alone in Allentown in a state that is with an insurance commissioner that is not warm and fuzzy to DPC, I'm always watching my back. And I had to watch my back as a solo practitioner too in the insurance system. So and Pennsylvania is a very litigious state to begin with. So I was watching, all the questions on social media about some of the doctors, with the compliance questions, and I was like, these people are going to, we gotta help. And so I put together, and it's very expensive. I went online and I've done some of them. It's very expensive to go through compliance training online, and these doctors are starting, including myself, on a dime. Some of the direct primary care doctors are taking out second mortgages, downsizing, all kinds of things to get financially to get their practices going. So I put it all together in an affordable manual, made it easy for them, because time is money too. And the amount of time they're marketing and they're recruiting their patients, plus we're spending so much time taking care of our patients. The last thing anybody wants to do is sit up at night and write policies for their office. And I can tell you it takes a long time. So I put it all together in an affordable, downloadable publication online. They can download the Word documents and they can alter them to their practice, but the backbone's there. I had a healthcare attorney review it in Harrisburg. He was, good with everything, and trying to make it easy and affordable for these doctors to get off the ground, be safe, and stay in compliance. Spend their money elsewhere on the advertising, spend their time elsewhere, spend time with their families. Because it is a lot of work and it is scary. It's not for the faint of heart, opening a DPC practice. It's getting easier, I think, as the model gains acknowledgement and acceptance. But so that's really where my story comes from for writing my manual on compliance for DPC. And that's really it. Thank you.